My name's Alaina and I'm a doctor of physical therapy and clinical content manager here at OneStep. Today we're going to be discussing the diaphragm and diaphragmatic breathing. Before we get started, don't forget to subscribe to our channel so that you can be notified when we release new videos. Before we get into diaphragmatic breathing, it's important to understand the diaphragm, what it is, and how exactly it works. So the diaphragm itself is a dome-shaped muscle, and it sits at the bottom of your chest, separating your chest space from your abdominal space. When the diaphragm contracts, it flattens downward like so, creating a vacuum-like effect, and then inhalation happens. So you're taking air into your lungs. That's flat. Then when it relaxes, it domes back up and pushes air out of your lungs during exhalation, or when you breathe out. So what is diaphragmatic breathing? Diaphragmatic breathing is when you take deep breaths and really engage your diaphragm muscle along with your core muscles. Doing so exercises the diaphragm itself because it too is a muscle and helps facilitate deeper, more effective breaths. This decreases the work of breathing in itself, and also diaphragmatic breathing can impact your cardiovascular system by lowering your heart rate and your blood pressure. That's why it's often used to reduce anxiety and is part of many relaxation techniques, including some meditative practices. So if you want to give diaphragmatic breathing a try, I often recommend that you begin laying on your back just because it's a bit more easy to facilitate it in that position. However, it is more convenient to do it in a sitting position. You can do it at work, you can do it really anywhere in a sitting position. So for the purpose of that, I'm going to show it to you in sitting in this video. So a cue that I usually give my patients would be to put a hand over your chest like this and a hand on your lower stomach right here. These are your two guides, so to speak. So what you're trying to do is take a nice deep breath down towards your abdominal region. So a way that you know that you're achieving this is your lower hand should be the one rising during inhalation or when you're breathing in, and then lowering. I'm going to show you diaphragmatic breathing. Watch my lower hand. And again. You can see my lower hand is the one doing most of the movement. Again, you don't have to be perfect. It's not like one hand is going to be completely still. Everything is connected in this region. So as long as when you're doing diaphragmatic breathing, you're getting most of the movement in your belly region, then you're achieving a true diaphragmatic breath. Thanks so much for joining me today. I hope that you learned a little bit more about diaphragmatic breathing, or belly breathing as you might often hear it being called. Feel free to give it a try and let us know in the comments how it went for you. I'd love to hear about your experience and any questions that you might have. Don't forget to subscribe, and I'll see you next time.